Good afternoon. My name is Sakira Cook. I'm the director of the Justice Program at the Leadership Conference on Civil and Human Rights. The Leadership Conference is a coalition of about 200 national organizations working to promote and protect the civil and human rights of all people in the U.S. I first want to thank you for joining this call today on what is a really important issue, an urgent call to action to ensure that incarcerated people and their loved ones are not forgotten during the throes of this unprecedented global pandemic. In the last few months, Congress has passed 3.5 stimulus packages. However, those bills have failed to fully protect the most marginalized in our society. As Congress considers the next stimulus package, we want to ensure that the health and safety of people in jails, prisons, and detention centers, and those who have been released are a priority moving forward. Already, 11 of our 15 largest COVID-19 hotspots in the US are correctional facilities. And medical experts are clear that the only responsible way to address the emergency is to release as many people as possible, especially the most vulnerable. That's why today's call is so important. On today's call, we want to make sure to communicate to you that you have the power and influence to determine what our policymakers do with respect to this population. And we must take action today. Let's move forward and I'll introduce our first speaker. We are joined today and so grateful to be joined today by Congresswoman Karen Bass, who is the chair of the Congressional Black Caucus and has been a leader and champion on this issue for very, very many years, but especially during this difficult time. Congresswoman Bass.
Thank you so much. And let me just thank everyone on the call for all of the work you do. Andrea, thank you for having patience with us and putting up with so many calls. And let me just tell you that I'm on for a hot minute because I am actually in the middle right now of trying to fight for the language that we need to have put in the next CARES bill around this issue. So I can't emphasize it enough. All of your advocacy, your phone calls to the speaker, to McConnell, we need to have the voices now. My role is to work on the inside. Your role is to help us on the outside. And let me tell you, finally, I think people are getting it. You know, my beef was everybody understood nursing homes and nobody understood prisons. They weren't feeling it in the same way. So we did this call on Friday with members of the leadership of the House, and they've been talking about it ever since. Because, you know, I mean, it's great you have the news stories, but the news stories aren't saying what should be done. And so calls to media that's saying release people is what needs to happen. We don't need to just keep hearing about the stories. I'm beginning to call our prisons and jails death camps because that's, you know, what they are. And if you don't care about the prisoners, then what about the people who on the outside, the folks that work there that have to come, you know, that have to come home. So I just can't emphasize enough how important your role is. We were also just a few minutes ago, and Janice was on the same call, I'm getting ready to jump back on it. We were talking about the plight of juveniles as well. So we're going to push, but now here's my thing too. It's one thing to get people out, but where are they gonna go? So at the same time, we are fighting for money to be put into re-entry programs. Andrea raised the issue that we're also trying to deal with, which is, you know, nonprofits can access the small business pot of money, but not if you're formerly incarcerated. So in addition to trying to remove those barriers, we also want to remove the barriers to TANF, to SNAP, and to public housing. All these crazy barriers we put up for people who, when they get out, then they're trapped. So we're trying to get waivers from that as well, and any of your other suggestions, but phone calls to the leadership, talking to the press, tweeting right now about what should be done. Not just that a lot of people are dying in prison, what should be done. That's what the media needs to focus on now. So thank you so much for your help. I look forward to us continuing to work. And let me just say that after we pass this next bill, and this is just my opinion, I think this crisis is so profound that there are going to be many more bills to come. So we're going to get what we can in this bill, but that doesn't end it. We're going to keep fighting until we are able to transform this system, which is, in my opinion, and embarrassment of our country to the world. Thank you.
That's me. Thank you so much, Chairwoman Bass, for your stalwart advocacy and leadership and your commitment to this issue and to our people. Next, I want to invite my colleague and friend, the Executive Director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls, Andrea James.
Hi, Sakira, thank you very much. And I just want to really say thank you to Congresswoman Bass. She has centered the voices of formerly incarcerated people, and particularly formerly incarcerated women, to be a part of this conversation, to contribute our thoughts and our ideas to how do we get to the other side of this and all of the issues that she raised up. So again, I want to thank her for all of the opportunities we've had to be a part of these calls. Mostly, Sakira, on this particular call, I'd like to again take this time to raise awareness of the conditions of confinement, of what's going on inside of the Federal Bureau of Prisons. We still are being inundated with calls from family members and also letters and phone calls that we are documenting of incarcerated women who are calling in to tell us about the atrocities, the humanitarian crises that's happening within the walls of federal prisons. And so I want to give you 3 quick examples of that. The first one being at Dublin, where the women are calling to let us know that women are still arriving, which is something that is just, we're not understanding that. How are the US Marshals still delivering women into these prisons? But they are still arriving, 40 as the last count who are arrived, and those women were quarantined into a visiting room at Dublin. Dublin is a women's federal prison in California. And the women who have been there already, there's 2 parts to Dublin. There's a federal prison camp and there's a higher security FCI. The women who were most vulnerable populations that were at the camp have been just mind-blowing. They have moved these women, Sakira, into the FCI, which is the higher level prison. And in that prison, the conditions of the level of medical care that already vulnerable women who have cancer, who have diabetes, who need insulin and chemotherapy, those treatments now are not being delivered at the level, and they have certain medical devices such as pumps that are not allowed down in the higher security prison that they had access to for their health at the other prison. I'll be very quick about this. The second one is our concern about the women at Carswell still. As you know, we talked last week about Andrea Circlebear and her dying. She was serving a 26-month sentence for a drug case, and she died in childbirth, on a ventilator, emergency C-section. That 26-month drug sentence turned into a death sentence for her. She leaves behind a total of 6 children, including her young newborn. And those reports that we're hearing of other women in Carswell. Carswell is a medical prison. That means that everybody there is being sent there because they have a very serious and significant medical condition. And they are not receiving chemotherapy. They are not receiving their insulin. The same stories are coming out. We are very, very concerned. And finally, I want to just raise up the conditions of confinement that are happening at Danbury. Danbury is a place that is under siege right now. There have been women who have been tested. 10 of the women tested and are positive. I think that number may have gone up since then. Women are literally being passed out to the kitchen. Why would you send women who have tested positive for COVID-19 to a kitchen dining room where these women are being spread out, but not social distance, in groups, are being spread out and placed within the classrooms, the dining hall, the kitchen, the visiting room, in clusters. Some of them with already having been tested and positive for COVID-19. We're asking Congress to please, these are death camps. These are death places, men and women and children. We have to release, release, release. We're asking Congress to please, for the federal prisoners to take over the control of home confinement. Congress has the power to do that, to get these most vulnerable pregnant women, the elderly, and people who are sick and with compromised immune systems out of there immediately, and use their power that they have to do that. Most of the people in federal prison have families waiting to receive them. They have somewhere already to go. The other thing that we need desperately is that we need stimulus money that is provided directly for those of us in our organizations that are on the front line. There's a lot of frontline people, and we're one of them in our communities where no money, no stimulus money as of yet has trickled down to. We need help, and we're asking for all of those barriers that Congresswoman knows about and that she is fighting on behalf of us for. Remove those barriers that preclude us from receiving the funding that small business owners who are formerly incarcerated desperately need. Thank you for this opportunity again, Sakira.
Thank you so much, Andrea, and for sharing those stories of conditions of confinement. And this is why the urgent call to action is so necessary right now, because we need this bill to make sure that all of those issues are covered. And I want to now turn to Patricia Richmond, who's the National Sentencing Resource Council at the Federal and Public Community Defenders. They've been on the front lines helping their clients in federal prison to file petitions for release, for early release. And so, Patricia, please share with us what's happening with respect to the situation with BOP and DOJ. Patricia, you're muted. We can't hear you. Uh-oh. No? Can you all hear Patricia? You were just working.
Tell her to lower her volume and bring it back up again, and it might kick it in.
Yeah, lower your volume and try to bring it back up.
Can you hear me now? Okay. Thank you. Sorry about that. Thanks so much for having me here, and I'm sorry for the delay. The federal public and community defenders represent 90% of people in the federal system, and in that role, we are bearing witness to a humanitarian crisis. As we speak, a third of people who are incarcerated in the Federal Bureau of Prisons meet the CDC criteria for elevated risk of death based on their age or medical condition or both. That's 50 to 60,000 people. They are all in incredibly dangerous environments that make cruise ships look safe. They live in housing units with anywhere from 30 to 100 other people, sleeping in bunks 3 feet apart, sharing 1 or 2 toilets, 1 or 2 sinks, and 1 or 2 showers, eating at small tables shoulder to shoulder. It is the exact opposite of social distancing in these facilities. The only responsible way to deal with this situation is to identify vulnerable people and get them out of danger. It can be done responsibly and consistent with public health. But instead of doing that, the Department of Justice is putting up roadblocks at every turn. It wants the public to think that it's doing something, but it's not. It's issuing a bunch of confusing memos and misleading press releases, but behind the scenes, it's not letting people out. It's opposing release when people seek bail or compassionate release. And it's doing so in a really disingenuous way. It's touting its remarkably low rate of infection as shown by testing. But the testing numbers are meaningless. They have tested only a tiny, tiny fraction of incarcerated people. And of the tiny number who've been tested, over 70% are positive. We know that the virus is widespread. They claim that conditions are clean and that staff and incarcerated people have adequate PPE. That's not true. Correctional officers and staff are filing OSHA complaints. They're filing lawsuits about these issues. At the Carswell prison in Texas, the one that Andrea just spoke about, the place where 30-year-old Andrea Circle Bear died, at 8 months pregnant, a corrections officer wrote Senator Cornyn on April 7th to warn of a looming catastrophe because of the lack of guidance from BOP about sanitation or PPE. Over a month ago, Congress gave the Attorney General the authority and discretion to make robust use of home confinement, but he has barely used it. Recently, a judge called out prosecutors for passing along false claims and said, "You need to tell me the criteria for this home confinement program." The prosecutors could not answer her. Why not? Because of, and I quote, ongoing uncertainty surrounding home confinement eligibility criteria. Ongoing uncertainty. Over a month after the first death in BOP custody and 2 months into the COVID-19 emergency, there should not be any uncertainty about home confinement criteria. People are dying. 41 people have now died. There should be nothing but certainty about responsibly getting as many people out of those facilities as fast as possible. I don't know any way to describe this behavior other than to say that it is cruel, it is inhumane, and it reflects an absolute failure of leadership at the Department of Justice and at the Bureau of Prisons. Because Department of Justice and the Bureau of Prisons have proven that they won't do the right thing, Congress must act. We need to bar the pretrial detention of people who do not pose a threat of violence to others. We need to give judges broader tools to responsibly release people who are currently incarcerated. And we need ongoing and universal testing to protect people who are incarcerated and staff who work with them. Thank you so much, Sakira.
Thank you so much, Patricia, for sharing what the federal and public community defenders are doing on the front lines to help release as many people as possible. We are now joined by Congresswoman Ayanna Pressley from Massachusetts. We are so pleased to have the Congresswoman with us today. She has been working hand in hand with Congresswoman Karen Bass, who was on earlier, to ensure that our priorities make it into the next stimulus package. And so we are so delighted to have her and hear from her. Congresswoman? Oh, you're muted, Congresswoman.
Okay. All right. Mic check, mic check. Am I here now? Very good. Well, it is a gift to be in virtual community and at this table with all of you. I'm immensely grateful for all of you. There's no place else I would rather be right now in this moment than with you. I don't know about y'all, but today has been a hard day. I am just tired and you know, yes, these failures have to do with leadership, but it is just the ongoing callous disregard, just complete indifference for Black and brown bodies, and it is just hard. So you all are just the balm that I needed at this moment, so I thank you for what you're doing every day. I'm grateful for our esteemed chairwoman, Chairwoman Bass, who hopped on earlier. And I just want to commend her for her leadership and also her vigilance. She continues to move the needle when it comes to centering the needs of our brothers and sisters behind the wall, and was doing that well before this pandemic, put their safety at even greater risk. I'm so grateful for her. And my being here with you today is no coincidence. Like many of you who do this work, I approach the issue of justice and healing with the soberness of lived experience. And for me, the safety of our incarcerated brothers and sisters is deeply personal. My father was in and out of the criminal legal system because of crimes he committed. Again, crimes he committed while battling an opioid addiction. But I never saw my father as a criminal. He was someone who was sick and committing crimes simply to support that. And what my father needed and deserved was on-demand treatment, culturally competent care to address the traumas that led him to self-medicate in that way. So like many or all of you that are part of this convening today, I know intimately the trauma, the shame, the isolation of having a loved one incarcerated. And although my father is no longer incarcerated and is also sober, and I'm grateful for that, I know the fear and frustration you all must feel as this government fails to address the public health and safety crisis in our prisons and jails. The calls that I received late at night of people pleading for their loved ones is deeply resonant and haunting and infuriating that we have to fight this hard. But this is a fight we continue to take on, and we take on together because they are worth it. And so that is why so many of us in Congress are working to ensure our brothers and sisters behind the wall do not continue to be left out or left behind in our relief. First and foremost, decarceration remains a top priority. I'm proud to support the Emergency Community Supervision Act, which would release vulnerable folks from prison and into any community supervision, and the COVID-19 Correctional Facility Emergency Response Act to help states with their release efforts. We must also ensure that Congress includes support for our returning citizens so that they have access to housing, food assistance, and health care. As I've said on previous convenings, you know, we can't treat trauma with trauma, but that's exactly what prison does. And so it's so important while we're pushing for compassionate release and clemency and decarceration that we fight for the surrounding and wraparound resources to make sure that folks aren't going from one vulnerable situation into another. And they have the access to housing and food assistance and healthcare that they need and that they deserve. I look forward to joining my colleagues in advocating for the inclusion of these efforts in the upcoming relief package, given that over 90% of incarcerated people are held in state and local prisons and jails. Our efforts cannot end at the federal level. Just yesterday, I led several of my colleagues in a letter urging our nation's governors to move urgently and decarcerate so that we reduce overcrowding in our state correction facilities. More than any other public official, governors have the power with the stroke of a pen, if they just chose to prevent this virus from claiming even one more life in prison. It's crucial that we keep the pressure up and urge them to use their power to do so. And I so appreciate the words of the sister that spoke before me, centering and bringing in Andrea Circle Bear, who died last week in federal custody. One of the bills that I've introduced as a freshman member was a part of a larger suite of bills to address the maternal mortality crisis. And the fact that I had to even introduce a bill, Justice for Incarcerated Women, the fact that we have had to introduce legislation to stop the shackling of incarcerated women speaks to just how lost we are, that we have to offer guidance. She shouldn't have been in prison in the first place, and she spent 4 months in prison pregnant and delivered her baby while on a ventilator. If you are not outraged, governors and everyone else, you are not paying attention. Some would say that COVID-19 killed Andrea, but for those of us on this call, we know indifference. Just callous disregard and indifference that killed her. Crimes don't go to people, go to prison, people do. And their families do. Every day we keep the men and women in crowded and unsanitary conditions, in solitary confinement for days and weeks on end, in fear for what is surely to come as this virus spreads, is simply another opportunity to rob a child of a parent, a caregiver, or a mother of a son. In the district that I represent, the Massachusetts 7th, 1 in 4 children in my district have an incarcerated loved one. We can't allow that. And I will assure you that I will continue to conduct oversight of this administration's mishandling, their criminal negligence of this pandemic. And so I'm grateful that we're all convened together today. I'm grateful for the role that you're all playing as activists, as agitators, as disruptors, as table shakers. And as a member of Congress, I just want you to know that we see you, we hear you, and we will not stop fighting until justice is realized for everyone. Thank you.
Thank you so much, Congresswoman Pressley, for those words, for your stalwart advocacy and commitment to justice, and your commitment to oversight is an important and critical point that I think we can't lose sight of, even in these virtual times. It's difficult, but I know you are the right person for the job when it comes to holding this administration accountable and working with your colleagues to ensure that this community is protected. So we really do thank you for joining us, and thank you for those words. And I want to lift up something that Congresswoman spoke to, and this is a great segue to our next panelist, about the fact that this is happening not only at the federal level, but at the state and local level. And Congress can play a role in helping to decarcerate, to support people who are, and protect people who are incarcerated, and to ensure that people, when they are reentering, have the necessary supports that they need in order to do so. And so I want to now turn to Ms. Denisha Jackson, who is going to share the story of her loved one who was currently being held in DC jail. Denisha?
Hello. As she said, my name is Denisha Jackson. I'm speaking out for my fiance, Tyrone Hall, who is currently incarcerated at the DC jail because he violated his parole and ended up catching a new charge. Tyrone has always worried about the cleanliness of the DC jail. Ever since he was locked up in July, he complained about how unsanitary it was. Since the pandemic, you would think that the jail would have increased the cleanliness, but that wasn't the case. The jail sent out a letter to the inmates with the proper protocol for how the jail needed to run under these circumstances, but neglected to follow the rules. My fiance has kept me updated on everything that has been going on in the jail. The biggest issue was that the inmates had no bleach or Lysol to clean anything. He continually read in the paper how important cleanliness was, so he continued to ask for cleaning supplies. They only gave the inmates soap. Sometimes the jail would even turn the water off for hours at a time. As of May 6th, inmates still didn't have anyone cleaning their cells, the recreation area, or the phones properly. When Tyrone asked other inmates to join, they organized a peaceful protest to ask for cleaning products. The correctional officers wrote him and a few participants up and also didn't give them the supplies. 3 weeks ago, Tyrone's cellmate tested positive for COVID-19. And the days that followed, Tyrone was sick and asked for medical help multiple times. He wasn't tested for another week. When he finally received the test, it came back positive. Once the results came back, the jail moved Tyrone to a quarantine block with the rest of the people who tested positive for COVID-19. On this block, there was no treatment going on. Some of the inmates, including Tyrone, went days without a shower because the block had no shower schedule, and on most days, no staff. Sometimes the nurses would come and sometimes they didn't. The jail kept Tyrone on the quarantine block for about 7 days before releasing him back to general population, which still had people testing positive for the virus. They sent him back without testing to see if he still had the virus. They even released him to a double cell instead of a single one. I'm scared for my fiance's health because he has asthma, carries a sickle cell trait, which weakens his immune system, and suffers from anemia. Tyrone is vulnerable to the worst forms of this disease. I am also scared for the health of other inmates at the DC jail. The facility does not provide inmates with adequate medical care. It fails to ensure proper quarantine, and it has forced inmates to live in unsanitary conditions. Without action, more people will get sick, and for the many consequences, they will be serious. Tyrone doesn't deserve this. He's locked up for a minor parole violation. There are many people in jail for similar minor offenses. But quite frankly, even the people in jail on more serious charges deserve better. No one should be trapped in an unsanitary facility without adequate medical care, as the virus spreads throughout it. We need Congress to act and act now. The federal government should give state and local governments the funds they need to reduce jail and prison populations, obtain tests inside facilities, and provide personal protective equipment to incarcerated persons and staff. Unless Congress takes these steps, the consequences for inmates around the country will be unspeakable.
Thank you so much, Denisha, and
You're welcome.
continue to pray for you and your fiance and everyone else who is currently incarcerated at DC jail. I know that there are people in Washington, DC who have been camping outside of the jail to call attention to the humanitarian crisis that is happening, and we will continue to press Congress to do what they can do to ensure that folks at DC jail, but jails around this country, are able to be released. I now want to welcome Richard Wallace, who's the founder of EAT, Equity and Transformation in Chicago. And Richard will talk to us a little bit about the work that they are doing to ensure that people at the local level are being released and have the supports that they need. Richard?
Yeah, hello, my name is Richard Wallace. I'm the founder at Equity and Transformation. Thank you all for being here. And just want to salute and commend everybody that's on this call. Just the dignity and presence and grace of everybody that's on this call, because I think it's something unique about us as Black folks. Like, we have to, one, experience the trauma while being in the process of solving the issue. And I don't know many folks who do it with as much grace as we do. And I just want to say how proud I am of all of the folks on the call right now. So again, my name is Richard Wallace, founder at Equity and Transformation. We organize in the informal economy. The informal economy is the part of the economy that is neither taxed nor monitored by the state. It is where a lot of our folks end up after we have 19, 20 doors closed because of our background, right? We have individuals who have applied at McDonald's 15, 20 times and been denied time after time. And which is a major part of the problem that we're facing, right? If we live in a wage-based economy where you have to trade your labor for a wage, right? And you can't labor in that society because of your background, and you're caught in the catch-22, right? So a lot of our folks end up reoffending, or even worse, things like Eric Garner happened, Alton Sterling happened, where they get creative and they figure out alternative ways to create capital for themselves, and they get killed in the process, right? Eric Garner was selling loose cigarettes. Alton Sterling was selling DVDs. And I doubt that's not an easy hustle, right? That's not something you would choose to do. It's not making $1 million. But at the same time, they were accosted by police and killed, right? So given the unattainable conditions in jails right now, what we're seeing is that a lot of folks and policymakers are deciding to decarcerate. And one of the things that I'm finding challenging, even at home, is that society kind of bifurcates Black life into silos of deserving and undeserving, right? That this person or this individual is deserving of intervention because blah, 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 whatever reasons. And what we saw with both the county jail and then also with the provisions that were laid out as far as who deserved to be included in the CARES Act was a severing off of a particular segment of our society, right? And of Black communities, right? So folks who didn't owe child support, who owed child support were not eligible, right? And who probably needs resources the most. If you can't afford to pay child support, you're probably in the most need, right? So these contradictions that they stem up, and it's never like in the broad, it's in the fine print, it's in the footnotes. It'll just say child support, those who owe child support. And that's a kind of an issue that a lot of people are kind of, it's complicated, but at the same time, those folks are in need of support. And then we look at the county jail and some of the things that we've done around the county jail. Right now, about 1,000 or 1,300 people have come home since COVID hit. Here's the catch. Of that, this is from the county jail. Of that, about 500 went on electronic monitoring, right? So this is the challenge. One, I've been in prison myself. I lost my father in prison in 2011. We used to write letters to each other, send them to my mom. You know, it was a really complex thing that we had going. And he passed away from cancer. And I remember so my mom had a little bit of weight. Her name is Reverend Green. She's done a lot of work in the state. And she thought that she would be able to get him a can of Ensure, right? He went from 220 pounds, right? And he got screenings for colon cancer every year. And all of a sudden, he went from 220 pounds to like 160 over a course of 2 months. And there was nothing that we could do. So for every family that's suffering right now, I feel for you, because it's a challenging circumstance to realize that your relative, your loved one, is property of the state now, right? And now I think what we're really coming to grips with is that being property of the state, it creates a certain amount of powerlessness for our people, right? And although I'm advocating for all of the policy changes that are being said, that are being done, we did a direct action, we did a caravan to the county jail to raise attention and also let the people back there know that we're out there and we support them. We're also doing a mutual aid campaign right now where we're getting resources directly into the hands of the folks that were ineligible for the economic stimulus. But I think what this COVID-19 moment is showing for me more than anything is a real need for, I mean, shout out to Movement for Black Lives, I gotta say that. Free them all, you know, there's a number of things that we policy demands that we put out there, but we're also trying to embrace the hard work of actually turning to community and saying, what are these alternatives gonna be? Because at some point when we decide to recreate and abolish all prisons, we have to have something in place that says, this is what we're gonna do, right? And I think that's the work that needs to be done. And I think that needs really deep reinvestment. What's coming to the surface for me in Chicago is that what COVID-19 did is it brought to the surface the challenges that already existed, right? We live in areas like Austin, Inglewood, West Garfield Park, all $20,000 below the average per capita income in the city of Chicago. All of these neighborhoods were suffering way before this, right? We have areas like West Garfield Park where 81% of young Black men ages 17 to 24 are unemployed. How, and then on top of that, then Chicago becomes 70% of the COVID-related deaths in Chicago are Black. And it is predictable, right? If you look at the numbers, right? Looking at the numbers, you can see exactly where resources are spent and where resources are absent. And where the money is spent in Black communities is in prisons and jails, right? There's a website called Million Dollar Block that talks about that, right? So y'all should look it up, Million Dollar Block. It talks about all of that. So they are investing in our communities, but just not directly into our communities. They're those resources are directed to prisons and jails, etc. So I think one thing that I don't want to leave the call without saying is that this moment shows a direct need for real reparations. Right? And I don't want to leave that stone unturned. Economic investment in our communities is necessary, right? If everybody comes home today, what are they coming home to? 81% unemployment, right? High diabetes, et cetera, et cetera. I want all of my folks to come home, but I also want I want home to be something, right, for us in this moment. And I think that this moment is bringing that to the surface in ways that I don't think historically it has. There's a need for really deep investment into our communities, into the economic infrastructure. I think there needs to be mergers between service and organizing sectors, because the service sector is doing so much for our folks right now. It needs to be wraparound services for our folks as well. So that's my piece. I'm out of time. I appreciate being on the call. We could talk about this all day, but just shout out to y'all for doing this work. And I appreciate the invitation.
No, absolutely. Thank you so much, Rich, because I think you so eloquently connected all of the different aspects of our lives that this crisis has impacted, that existed before this crisis came into being, and really, you know, sort of elevated the number one call that I think connects all of this work is reparations. And that's something, HR 40 is another piece of legislation that we need to ensure gets passed and is directly linked to our calls for ending mass incarceration. I mean, our calls for equity and economic wealth and inclusion for African Americans, for housing, for healthcare, et cetera. So all of these pieces, I'm so pleased that you were able to weave them together and really articulate for folks the need and the urgent need use their voice to push on all fronts to ensure that these policy solutions are made real in this stimulus package coming up and those to come after. I now want to turn to and want to make sure that we do not forget the impact that the criminal legal system has had on youth. We know that our young people from very early on with respect to discriminatory discipline policies and practices in schools around the country are often targets and funneled into the criminal legal system very early on. And so we are now joined by Ms. Dawn Robinson, who wants to share the story of her son and who she is fighting for release from pretrial detention in Maryland. Dawn?
Hi, everyone. How you all doing? Can you hear me? Can you all hear me? Okay, I want to thank you all for giving me this opportunity to talk on behalf of my 17-year-old son. Again, my name is Dawn Robinson, and I'm in very deep concern for my son. My son, he committed a crime. I don't think he's a risk to the community at all. He's been held in an adult detention center in Charles County. And my main concern for my son is the COVID-19 that's spreading rapidly throughout prisons, throughout communities. And my son, he suffers from severe asthma. He's an asthmatic. His dad just passed the beginning of last year from a severe asthma attack. He lost his dad. And I'm just so worried about my son's health and his wealth and his well-being, him being there in that adult detention center with guys that's 10 times his age. He's only 17. I understand he made this one mistake in his life, but I don't feel this one mistake should cost my son his life. He's been sitting pre-trial. His court dates have been postponed. and he's just sitting with no explanation. And I'm so scared he's gonna come in contact with someone with the COVID virus. And if he does, it'll be fatal on him because he's a very severe asthmatic. I don't think they're providing the proper medicine for my son there. He was at the Cheltenham Detention Center, the juvenile, and they were giving him everything he needed. Now he's got everything taken away from him, his health, education. He's a senior. This is his last year of high school. He's a senior in high school. My son, he's supposed to be home with family, about to enjoy prom, graduation, but he's sitting in this adult detention center with all this COVID, this virus going on, and I'm very, very scared for my son. Like, it took a toll on my family, especially me as his mom, and me having my juvenile son sitting in an adult detention center is just not right. Like, I know he committed this crime, he did, he made this one mistake, but this one mistake should not cost my baby his life. I believe he deserves a second chance. And where he is now, I don't think it's safe at all for him being there. He calls home, he's under deep depression. He say, "Mommy, it's so dirty in here." Like, he say his ants crawling around in the cells. He was celled with a guy 42 years old. Why would you have my 17-year-old son in a cell with a 42-year-old man? It's not proper. And I'm fighting for my son's freedom. And I think he'll be safer being here home with his family rather there with this virus going around, because I don't want my son to die in prison, get in contact with this COVID virus. I just don't. And I'm very scared for him. And I can't do anything. And I'm doing everything I can to fight for him to get his freedom. And I want him home. He's not safe there at all. And I just want to thank you all for giving me this opportunity to speak on my son, on his behalf, because he can't voice his opinion right now. And I'm his voice right now. And I believe they not giving our youth a fair chance with this juvenile, this prison system is not giving our juveniles a chance. And my son, he deserves a second chance.
Thank you so much, Dawn, for sharing the story of your son and having the courage to continue to use your voice to amplify on his behalf, but also on the behalf of other young people who are held in detention facilities. And to be clear, your son is held pre-trial. He has not been convicted of any crime. He is an accused person, and accused people have the benefit of innocence until proven guilty. And so because of that fact alone, he should be released, not to mention all of the other things that you mentioned with respect to his medical conditions and the conditions of unsanitary and unsafe conditions that exist in that adult facility. I now want to turn to James Dold, who is the founder and CEO of Human Rights for Kid and has been a champion of youth in youth from prisons and jails around the country. So James.
Great, thank you so much, Sakira. And can everybody hear me? All right, let me first start off by just thanking you, Sakira, and the Leadership Conference for your incredible leadership in convening this call, as well as making sure that members of Congress and congressional leadership are taking a lead on this issue. It's really important. I also just want to thank Ms. Robinson, Andrea James, Denisha, everyone who's been directly impacted by this issue for using your voices and speaking out. You all are incredibly inspiring, and I just want to thank you all. And then lastly, Congressman Presley, as well as Congresswoman Bass for their leadership on this issue. Human Rights for Kids, we are working to advance and protect the human rights of children in the justice system, kids all around the country, in the juvenile system, in the adult system. And there are really three populations of kids that I want to talk about today. The first, I'll start off discussing Ms. Robinson's son. Those are kids who are being held in adult facilities that come under the jurisdiction of the Department of Corrections, oftentimes at the state level. Those are kids who are being held in adult jails or in adult prisons within the Department of Corrections. They oftentimes get left out of the conversations because when kids are transferred in the adult system, they essentially lose their child status. It becomes irrelevant to many of the system stakeholders, and they're treated as if they were adults, which is a violation of human rights. Not only what happened to Ms. Robinson's son was a violation of his human rights, but it's also a violation of federal law. The Prison Rape Elimination Act prohibits the incarceration of children in adult jails and in adult prisons where kids come in direct contact with older adult inmates. And so what's happening to her son right now is a human rights abuse on multiple different levels. And I think it's really important to call it what it is. It's also important to discuss the racial justice aspect of this as well, because what we know from the data is that roughly 80% of the kids who are prosecuted as adults are African-American children. So this is something that's disproportionately impacting our community and that leaders in Congress really need to take note of, because it's a racial justice issue, it's a human rights issue, and we're incredibly worried about the kids in the adult system who could potentially come into contact with the COVID-19 virus, especially those who have underlying health conditions like Ms. Robinson's son. The second group of kids that we're very concerned about are kids in the juvenile facilities. These kids oftentimes, because the Division of Children and Family Services usually has jurisdiction over them, they're usually under the HHS at the state level. And those kids are also of great concern to us right now. And these are kids oftentimes who are being held on lower level charges, nonviolent charges. And for many of them, there's absolutely no reason why they should continue to be in juvenile facilities. We know right now from the numbers that there are about 229 kids in more than 26 states across the country in juvenile detention facilities who have contracted the COVID-19 virus. And one of the things I want to say about this population too that's really important to understand is we know that the vast majority of these children, 90% of them, have been exposed to adverse childhood experiences. They have at least 2 prior childhood traumas in their life. And this is significant because what we know about ACEs is that it actually increases the likelihood that these children also have chronic health issues. And from the subsequent studies that have been done, we know that these kids have higher rates of having severe asthma, just like Ms. Robinson's son, having heightened capacity for developing hypertension, diabetes, and all sorts of chronic health issues. So I think there's this notion that we need to dispel, this myth that kids aren't particularly vulnerable to the COVID-19 virus, but that couldn't be further from the truth when we're talking about kids in the juvenile and criminal justice system, because they are more likely to have these underlying health conditions that makes it more likely that they will develop complications from COVID-19. And so we're trying to make sure that members of Congress, leadership, and state officials understand that, because we don't want another tragedy to happen like what's been happening in the adult prisons with individuals across the country. And then the last population I just want to talk about just briefly are people who were children at the time that they committed offenses, but received very lengthy prison sentences, mandatory minimum sentences, and are now older adults who may be elderly or have chronic health issues as a result of being incarcerated for so long. I want to share just briefly the story of Mr. William Garrison, who was a former juvenile lifer in the state of Michigan. Mr. Garrison had earned his freedom after the U.S. Supreme Court had ruled in Miller v. Alabama and Montgomery v. Louisiana that life without parole sentences violated the 8th Amendment. These are also something that we know to be human rights abuses against children. Mr. Garrison, however, was resentenced. Earlier this year, he was granted parole. But because of the COVID-19 virus and delays in his release, he contracted it early last month, and then tragically died right before he was scheduled to be released this month. So instead of his family celebrating with him his freedom after more than 44 years, let me say that again, 44 years of incarceration for the crime that he committed when he was 16 years old, their family is now having to bury their son, their brother, the person that they love. And there's absolutely no excuse for that. So these are individuals that we're also very, very concerned about in the criminal justice system in terms of these 3 groups of children or people who were children at the time that they committed their offenses who are now in our prisons. And so in a call to action, one of the things that we're trying to highlight for Congress and for state legislatures around the country to do really is first and foremost with kids who are juveniles right now, making sure that any kid who's held on a nonviolent crime is automatically released. Kids who, regardless of crime that they have have committed, where they're not a danger to society, are immediately released to their families, and kids who are close to their release dates. There should be a rapid release of all of these children across the country, as well as making sure that for people who have come home already, that it might be on state supervision, that the economic burden is eased from them. So we're calling for the suspension of all supervision fees across the country for state parole boards or state supervision boards. And then also for the paroling authorities and judges to expedite the consideration of individuals who were children at the time that they committed offenses, who've been in prison for a very long time, who have underlying health conditions or who might be particularly susceptible to the virus, to make sure that their consideration for release is expedited through this process. And in closing, I'll just say that I just want to quote Nelson Mandela, who's one of our heroes at Human Rights for Kids and one of my personal heroes as well. Mr. Mandela once said that there is no keener revelation of a society's soul than the way in which it treats its children. What we do in this moment and how we respond to this crisis, particularly when it comes to our most vulnerable people, will tell a great deal about the character of our nation. And so we would urge everyone to do everything that you can to get members of Congress on board. And I just want to thank again Secura and the Leadership Conference for convening this call and having us participate. Really appreciate it.
Thank you so much, James, for highlighting the plight of our young people. And as you said, you know, if we don't take care of our children, who are we as a country? These are the future leaders of our nation and of our society. And then to sort of cast them out is, you know, particularly problematic and a human rights abuse and violation. I want to thank you all for sort of sticking with us on this call, and we are going to bring it home with my colleague and friend Monifa Bandele with Moms Rising, who is going to share our urgent call to action. Monifa?
Thank you so much. I also want to thank all the panelists. I especially want to give my heartfelt thanks and gratitude to Dawn Robinson, for sharing her story and uplifting a child. You know, I think sometimes because society strips Black children of their childhood, we tend to not think of them as it, but she really helped to put his story in perspective. And I think challenging us to heed to this call of action. We cannot look at her, listen to her, and move on from this call without taking action to protect her son and all of the many thousands of people that were discussed on this call. First, I want to say we absolutely cannot be told that it can't be done. In almost a week, a Congress that was deadlocked for 4 years coughed up $3 trillion, that's trillion with a T, dollars. We've seen all kinds of things happen and unfold in this unprecedented time, but when we talk about releasing our incarcerated loved ones, we're met with, it's not possible, we can't figure it out, there's not enough resources. We reject that. We know that it can be done. And I especially want to also thank the organizations that are led by incarcerated and formerly incarcerated people, like the National Council, RAP, EAT, because they have been pushing for governors to release all over the country. And there's been some movement in some states, and some states there haven't been. But now today we're calling on Congress. And it's been laid out very clearly in this call that we need 3 things. We need Congress to mandate that DOJ and BOP immediately release vulnerable people out of deadly prisons, jails, and detention centers for safety, for public health and for safety. The second thing is that for all of the people that are currently incarcerated, there must be mandatory ongoing testing, adequate medical care, robust funding for PPE for incarcerated people. Again, we're not functioning from scarcity. We know it can be done. Physical distancing and sanitation. And last but not least, we have to make sure what Rich said is actualized, which is that when people come home, it's a home that they can exist in and be safe and healthy there as well. And so we're outlining a couple of ways, and I think the screen is going to share that you can take this action. One way is going to be for you to call Congress. We've set up an 844 number where you call that number and you demand that the congressional leadership provide relief. I think that shared, right, you shared, I thought it shared my screen, because I'm on that screen. Provide relief and recovery to people who are incarcerated. All of the demands are outlined on this action page once you get to it. And everyone who registered for this call is going to get an email after the call so that you can sign the petition, so that you can share the petition, and so that you can call your congressional member. And I hope that you hear Dawn's voice. I hope that her story rings in your mind and your heart all night, next week, next month, next year, because guess what? There's hundreds of thousands of people pretrial detention every day in this country. And if we can change this now for public health, this can also be something that we can change for the future. So I want to thank Shakira as well. Please take the call to action, share it with your organizations, and also share back with us if you have actions that you want the broader coalition to push.
Thank you so much, Monifa. And I want to thank all of our panelists and speakers today, Congresswoman Karen Bass, Congresswoman Ayanna Pressley, Andrea James, Patricia Richmond, Richard Wallace, Denise Jackson, and Dawn for sharing your powerful stories, James and Monifa. And thank all of our partner organizations. We did not do this alone. We do this in community, in coalition. The National Council, Moms Rising, Civil Rights Corps, Law for Black Lives, Center for Popular Democracy, Color of Change, ACLU, Justice Roundtable, Sentencing Project, Movement for Black Lives, Defending Rights and Dissent, Innocence Project, Young Women's Freedom Center, Network Lobby for Catholic Social Justice, National Council of Churches, and the National Association of Social Workers, and Dignity and Power Now, and the Juvenile Law Center. So I want to thank all of you. Again, please do heed the call and take action today. Call your members of Congress. Please look at the email that you will receive immediately following this call. And you can call, you can tweet, you can email your members today, tomorrow, Friday, next week, and especially today. Please take this action because this bill is being written. You heard that from Congresswoman Bass. It's being written right now. She's on the call on the phone right now, negotiating language to include in this legislation. And these demands are critical and important. And so it is incumbent upon all of us, it is incumbent upon all of you to hold our elected officials accountable. We put them in there. Sometimes we don't, but they are there to represent us. And so they must do their job and do our work. And we have the power to ensure that that's happening. So again, thank you so much. And we hope and we will continue to push on this issue and continue to invite all of you into this advocacy and actions. And thank you again for your leadership as well. All of those who presented, but also all of you who tuned in, because we know each of one of you are an action taker and an advocate for justice. And so again, thank you, and we'll be in touch.